This would target the muscles that are coming from the trigeminal nerve. You can see the asymmetry of the face, and you look at the side view, you can see this is what we call extruded gonial angle, and we know the patient's been grinding really hard.
Hey guys, this is Dr. Ben Thompson with Treble Health. I'm joined here by Dr. Chris Chui. We're here at SF Dental Wellness in San Francisco. Treble Health is opening a tinnitus clinic in San Francisco, and one of our important medical referral partners is the dental and TMJ specialist here at SF Dental Wellness, including Dr. Chris Chui. So in today's video, we're going to do a clinic tour, learn about how the ear can connect to the jaw, and if you have ringing or hissing in your ears or an ear, maybe ear fullness, symptoms that other doctors just haven't been able to fix, it could be related to the jaw and the neck and the teeth. So that's what we're going to explore today, and I'm so excited.
There's tons of things to talk about coming for us. Welcome to my practice. We set up this office probably 7-8 years ago. This is where we are in downtown financial district.
All right, so what's in this room over here?
So we have the room in here, we're set up in here. We will have the patients that we bend us on you can have us sit here. Patients usually come in here and say, well, I have jaw pain. All the times we have to look at the medical history. What medication are they taking? What kind of problems do they have? Do they have any pain and jaw pain and neck pain and shoulder pain? And on top of that, of course, we always look at the ears and tinnitus and also the eustachian tube opening, which can cause the pressure in the jaw joint. They go, oh, I might feel like my ear's plugged because of that.
So how many of your patients with TMJ problems experience ear ringing or
A lot.
complain about it?
A lot. Actually, we have patients coming in just for ringing in the ears to start, because a lot of times ears, nose, and throat specialists, they understand that when they did all the treatments they have done, they could not figure out the patient's problem because they can do the CT scan, MRI, hearing tests, and everything is clear. They know that it's coming from the teeth and the jaw. That's why they refer the patient to us. We're going to do a take quick testing. I've never done it on him. We're going to do this.
He doesn't know what he's going to find.
I don't know his condition, but I already can see some things going on in here that he might have some issues. We look at the face, one side of the jaw is a little bit bigger than the other side. He probably have some tightness on the shoulders. He probably have some pain around some different areas. I'm going to go ahead and do a quick test on him. That because we're going to start with the nasal. Because when you look at the nose, sometimes you may have a little deviated septum. You might have a little bit of nasal obstruction in the nose. Now this is what I want him to do. Now go ahead and rotate the head all the way to the right side as much as you can. A little bit of tightness on the neck, right? And turn all the way to the left.
Yep.
Which side is tighter?
Turning left is tighter.
Turn left, tighter, right? So remember I told him this side is a little bit stronger. He's using the left jaw a little bit more. Now turn all the way to the left again. Mm-hmm. I want you to put your left finger, put it on the chin position and not the shoulders, as much as you can until you turn to the point that it hurts a little bit. Okay. Remember the pain. Mm-hmm. Okay, now let go, rotate the head back to center. Mm-hmm. So stay right here and don't move. This is going to be his reference point. Now, what I'm going to do is, I want to see if I can let him breathe better to see if I can get rid of his chronic pain. All these are connecting to the jaw and the neck. Now, I'm going to have him breathe through his nose.
Wow, I can instantly breathe a lot better. Does this look normal? Probably can't walk down the street like this, right?
So this is the first time I actually put it on his nose. It feels so much better. That calms you down. This is what we call activation of the parasympathetic nervous system. Relaxes everything, decreases heart rate and blood pressure. Now take a deep breath through your nose. Now go ahead and turn your head all the way to the left.
Yeah.
Way more from here to here now. Now back to the center. Now breathe through your nose more. Now turn all the way to the left again. The more he relaxes, the more he can turn, the more he relaxes the muscles. All these muscles are coming from the same area. Neck, shoulders. Just because he can breathe through his nose better, he relaxes more, the brain comes back and take control back. It feels good. Relaxes you, immediately feels better.
And it's very relevant for tinnitus. I've never done a YouTube video with this in my nose before. It's very relevant for people with tinnitus because the brain is getting the signal from the nervous system. The fight or flight response.
Exactly.
Feeling tight or on high alert, and tinnitus is louder, it's more bothersome. So I want to learn how that's all related. Ears, jaw.
Yes.
Shoulders,
They
breathing.
all connect together. Oops. The second thing that we look at is the jaw. Now, when he open and close, you might not hear, but hear little sounds coming from here. Now, open and close, you can hear that, right?
It's popping.
It's
a lot
popping.
of popping.
Now, go ahead and turn your head all the way to the left again. You can turn a lot more than the first time you saw him. right? Now go ahead and put your left finger in here.
Sure.
And this is the position of his neck after he can breathe through his nose better. Okay, let go, rotate the head back to center. Stay right here. I'm gonna see if I can allow him to feel even better by adjusting the jaw position. Now go and open and bite down. Now breathe through your nose. I want you to bite down and go ahead and turn all the way to the left. Way better. This is the first time I'm actually doing it, I swear. But from here to here, now back to center. I want you to bite down harder. Now breathe through your nose and bite down really, really hard and turn all the way to the left. Turn, 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 turn. Different bites can turn differently. And now go and bite down really hard and squeeze. Open. Why is it torqued differently? The bite. The jaw's torqued differently. Somehow, they torque these muscles differently can affect everything else. And that's why one side hurts more than the other side. It's really easy. Now go and put your fingers on the forehead.
Sure.
I want you to balance the jaw back by moving your jaw forward a little bit and bite down and grind as hard as you can.
It's definitely less intense up
Now
here.
move the jaw forward more, and it's also more different, right? So all these muscles are a lot more calm in tinnitus, right? Causing sound and causing sound, but
Because we know that tinnitus is so linked to stress. If you guys are watching this on YouTube, let us know in the comments if
This is crazy.
your tinnitus
This
is
is
linked to
crazy.
stress. Running a business can be stressful. There's many parts of life that can be stressful. But yeah, I did feel some shift of settling down a bit.
yes, because we balance the jaw back.
And I'm gonna put this in because I think I like it.
Yeah, it feels good. And I want to do another test on it because this
do it.
doesn't stop that because it affects the upper cervical area. Number one is you have some pain in the jaw joint here. Now open all the way and close, and that hurts.
Yeah.
Now go ahead and move the jaw forward, open and close forward. It feels better. The jaw closer to the nerve ending activates all these muscles in pain. Now I'm going to do a test on you. I want you to spread the fingers apart as much as you can. So for some reason, your right side is weaker than your left. There's something around here, send a signal to your brain. I don't like that. So if I can press on the ulnar nerve right here, and it hurts a little bit, we'll send a signal to tennis elbow, to the trap, go to the other side. You might press on here immediately, try to fight me. You just can't fight me on the left side. But if I can balance it back, now I'm going to press on it a lot longer, a lot harder. Now go ahead and fight me. You can fight me really well now. You can feel the strength. I'm trying really hard to bend you. All I want to do is just to take this away and spread your fingers apart. Immediately, you got weaker. So all these are coming from the neuromuscular feedback. So then we also take the scan. Then we can look at the scan and look at any anatomies, that problems with the jaw joint, position of the teeth, and they can come back and look at it. Oh, patient have more problems on the left side. Why? When we look at the scan, everything would make sense.
And you have some scans that you want to show us,
Yes.
right? Should we go
Let's
check
do
it
it.
out? Should we go check it out right now?
For sure.
Let's
Yes.
go. It's my souvenir.
So we have a scan in here. Look at the 3D rendering of a skull. You can see the asymmetry of the face, and you look at the side view, you can see this is what we call extruded gonial angle, and we know the patient's been grinding really hard for a long time. There's also extruded a lot more on the left side than the right side. This patient referred by ENT coming back for the tinnitus.
Yeah, obviously we have a close relationship here, and now that Treble Health has a San Francisco location, which we're working alongside ENT doctors, SF ENT in their clinic, there's a multidisciplinary approach here where ENT, tinnitus specialized audiologist, and dental TMJ and sleep specialists can actually really help a lot of tinnitus patients where that's not available in most towns or most cities, right?
Yeah. One thing I look at is here, you can look at everything in here with one scan, starting from the occlusion where the jaw got all the impact coming from the teeth. When you look closer with the intensity, so when you grind really, really hard on this, all the force is going to go to the gonial angle. Coming from the side, look at the contact here. The fossa is actually a really thin layer of bone. When someone has a jaw retruded to the back, so this is the back, this is the front, this is the front, this is the ear. So you can see the relationship between the jaw, the ears, the brain central nervous system goes all the way down, you can trace it back. TMJ's grinding, sleep apnea, snoring goes hand in hand. Now the jaw's retruded to the back a little bit, hitting the ears. That hurts a lot with headaches and migraine and jaw pain, neck pain, and shoulder pain. When the tongue retruded to the back a little bit more, the airway is smaller. That's why a lot of people, they grind their teeth, TMJ issues. The airway is compromised, you snore easier and have a much higher chance of getting sleep apnea.
Wow, there's a lot of factors involved here. Would you mind showing us the treatments that you guys offer? Because I know you do sleep apnea and TMJ,
Sure.
but I think for the tinnitus community, we're curious, what do the treatments look like for the jaw and the TMJ? You want to show me?
Yeah, we can go back to the treatment room and show you what we do here. It's actually really, really cool.
Let's do it.
Nice. The little tip is just a rough idea where I want to put the jaw back because it's soft. Now, the position should be coming straight from the patient's when the jaw's relaxed. So we use something that's called tensing. It's transcutaneous electrical nerve stimulation. Basically, we'll pass through some current, primary target 3 cranial nerves. Number 1, trigeminal nerve that we talk about. Second is the facial nerve, how we smile and frown with the scalp and all the way in the back. Third is the accessory nerve, which is controlling the neck and shoulders. So these is an ultra low frequency TENS unit that specifically target TMJ. Now, usually this is what we're going to do is try to find a tight spot for the trap because we're going to fine tune that position and that hurts right here, right?
Yeah, it's definitely tight.
That's connecting to the jaw pain that here earlier. So we find this position and just put the attachments here. There's another one on the right side. So we put the electrodes here, and then we can use the TENS unit to start to make him feel really good. It's like a deep tissue massage.
I want to feel really good.
Now, they all come with different parts. And this is the right side, ground, and this is the left side here. Right. Now we just start feeling a little bit tensing around the jaw right now. Can you feel the difference between left and right, or feeling the pulsations?
Feel a little clicking.
Now I'm going to start with their shoulders. So do you feel the little tensing on the shoulders?
Not yet. Okay, now I do.
Sorry.
Didn't take long.
Okay, now I'm trying to kind of balance a little bit to the left. You feel more on the right?
Slightly more on the right, but yeah.
Bear in mind, he has more pain on the left side. Sometimes it takes a lot more for you to relax. Yeah. Feels pretty good now, right?
I'm feeling very relaxed, yes.
Yes. So we will have to relax the beginning of the spine. Everything else relax more. The spine will line up a lot better. Think about the postures getting better. Other things that we can actually help the patient is laser. We can actually target the light directly into the eardrum.
Did you say lasers?
Yes. This is actually very cool. If you can actually wear this.
All right. This seems fun. This is a fun way to spend an hour with Dr. Chui.
We do this all the time. We just have a lot of fun in this office. We have a tip that we can go directly into the eardrum. Oh, not the eardrum, but ear canal. And kind of focus on the area that we shine a light on here. It's very gentle, but this would target the muscles that are coming from the trigeminal nerve. I don't know what you feel, but definitely it's no pain. It's very comfortable.
Very mild. It's almost like there's no effect.
So we use this a lot in dentistry for the longest time. We use this technology to put the platelet into the bone, but this has a really good success rate because now that separate the teeth allow this to open more and allow the soft tissue to remodel in steroid. Now things gonna start remodeling really fast and support everything back, and the soft tissue grow back and protect the bone from grinding each other.
Comprehensive TMJ treatment, would you say?
That's awesome. Back in here really quick, basically there's so many different things here, but basically we will just want to go back to the position. The most important thing is just the bite. When he's all relaxed, we can capture it in here. Every patient will come back with completely different bites, and that's why night guard doesn't work for a lot of patients. You can wear it, and it's all across the board. Everything is 3 millimeters. However, a different patient will come back after he tens. The jaw is going to give up and give a different position. And this has a really good relationship with the jaw when everything lines up better. When the jaw's relaxed, extraoral muscles, even including intraoral muscles, will open up the airway.
So what is this called?
This is a neuromuscular balance orthotic.
This is like a more advanced version of a night guard?
Yes. This is.
And you wear this when you sleep?
In the beginning, wear as much as you can.
Oh, like during the daytime?
Yeah.
Too.
Some people, they might even have other issues like sleep apnea or potential snoring.
So guys, we just did a full tour of SF Dental Wellness here in downtown San Francisco. Treble Health, the tinnitus treatment clinic. We have one of our first clinics in the country, which is in San Francisco. We're here just to collaborate and educate people on the connection between the ear and the jaw. We'll put your information on the screen right now, but what's your website and what's the best way for patients to reach out?
Phone number is area code 415-781-1944, and address is 130 Sansom Street, San Francisco. We are right in the downtown, in the middle of financial district.
All right, Dr. Chui, thank you so much.
Yes.
Thanks for having me. It was really fun and hope to be back soon.
Thank you.